Hi, Terry. I have been having some technical difficulties and I just introduced you, but I don't think anybody heard me. Can you hear me now?
I can now. Yes, this is the first I've heard. I was like, maybe I should log off. I'm not sure what's going on.
No, you are good. My apologies. Let me do your introduction a second time. I guess round one was practice. Um, Everybody, welcome to our HBMA Live today. We have with us Teri Bedard, who is the Executive Director, Client and Corporate Resources for Revenue Cycle and Coding Strategies. She is a frequent speaker and author for nationally recognized professional organizations and publications. Teri's areas of expertise include assisting clients in the areas of billing and reimbursement for physicians, hospital outpatient and vendor technology, monitoring government regulatory information, and seeking new business opportunities. How are you doing today, Teri?
I'm doing pretty good. How are you doing?
Doing well. I'm doing better now that we're here together and on HBMA Live. Yeah, it's a good accomplishment for the day. Teri, would you mind? Can you tell our viewers a little bit about yourself? Just give us a little bit of your background.
Sure. So my background is I do have a clinical background. I did study in radiology, and then I worked and studied in radiation oncology. I was a radiation therapist for about 9 years, working in the clinic and treating cancer patients with radiation. And I really liked the coding and billing when I was in the department. And I would work with our coders and billers and learning the codes and all of that. And each place that I've worked, I kind of got into that side of it. And as I thought about what else is there available for me to do, started looking out there and realizing how do I build on what I know from a healthcare standpoint, and really got into found revenue cycle at the time. And I've been with the company now 14 years, kind of working in different places and different parts of the company, but really with the coding, billing, and reimbursement and compliance.
Awesome. Exciting. You sound like you have a lot of the same interests that I do and like to geek out on all the fun technical stuff. Awesome. Well, that's exciting. So let's see. Let me pull up my list here. Okay. So Teri, we're meeting here today and we're on this HBMA Live to give a little bit of a sneak peek for our fall conference for the HBMA. Can you tell our viewers a little bit about what you're going to be speaking about at the conference?
Sure. I'm going to be talking about ICD-10 CM, which is diagnosis coding. And sometimes that's not the most exciting part. I mean, we really pay a lot of attention to the codes for the procedures we do. But I think it's important for everybody to remember that the code that we build for the procedures is typically what we're going to get paid. Is that diagnosis code that determines if we get paid. So it's really important. And I'm going to focus on what are some of the guidelines that we really need to be aware of, making sure we're coding to the highest level of specificity. Payers don't want us to have these unspecified codes. They want to know what kind of neoplasm. They want to know specifically, where's this pain? What kind of mass are we, seeing this patient for? So we want to make sure that we understand, some of the guidelines for how we code, what the documentation should look like. And then they did change. I think a lot of this had to do with COVID. They've actually updated the diagnosis codes twice a year now. It was always historically on the fiscal year calendar, coming once a year. We now have updates twice a year. So I want to make sure everyone's aware of that. They're looking for those and they know what some of the changes are, even going into 2023 already.
Right. That is, as if we didn't all have enough regulatory things to keep track of in our day-to-day businesses. Now we have 2 sets of ICD-10 guideline updates. That's a lot.
It is. And to make sure somebody's paying attention and knows, can kind of determine what they mean sometimes when they come out too. So, yeah.
Right. And can you maybe help me understand just a little bit, like, what is the difference in understanding the updates to the diagnosis codes versus understanding the guidelines that apply to the diagnosis codes?
Sure. So it's important that the codes themselves are so when we submit a claim to a payer, this is really, we use a lot of 5-digit, 7-digit codes to represent everything we've done for this patient, everything that talks about their diagnosis. And so what we're trying to convey a lot of information in a very short little, numerical, alphanumeric number that we have. And so it's important, the difference between the actual diagnosis codes, we want to know when they start getting more specific, or there's now more codes for more conditions that we're seeing patients report with. We use ICD-10 codes, and I've heard physicians say, oh, I don't, who cares? It matters. I mean, we track that to look at trends. We track that to see what's happening from a diagnosis standpoint. Payers look at that to determine, coverage determinations. So it's important to know specifically what codes are no longer available. Maybe that, that condition is it's not something that's seen anymore, or they're getting more specific so we can start coding for things that we couldn't before. The guidelines really kind of help us understand some of the language, maybe from a documentation. So if the physician doesn't state something in their note, we can't code for it. But maybe it's not very specific in their note. They now tell us we can look elsewhere in the medical record. They start to give you some of that understanding of how you find some of this. When do you apply to certain codes? Sometimes there's a lot of guidelines that tell you when they can be used and when they can't be used. And I want to really make sure people at least walk away with a baseline understanding of some of the importance of that. So when those conversations come up, or they're working with their coders or their billers, they understand some of maybe the problems or ways that they can head that off at the, before it becomes too large of a problem.
Perfect. That's really, really helpful. So, with the session that you're going to be presenting at the conference, what are the key takeaways that you hope attendees are going to get from your session?
I think one of the biggest things is to make sure there's that communication with the physicians, that they know that there's updates that are happening, but also the expectations. It's easy to kind of get into a rut sometimes. We use templates at times for our notes, making sure the physicians are aware when we can code, a little more specifically on things, or when we have to make sure we identify things. Payers, we have to jump through hoops. We have to dot our I's and cross our T's and make sure it's all, there, and making sure that they're, where, even looking internally, so that people can walk away and attendees can say, hey, we're having a problem here, or I've heard my biller or my coder say something about this issue. I need to go back and check to see, this is why we're not getting paid. This could be something from that. So it's kind of have that baseline to understand that diagnosis coding is very important. It's not just the procedures we do, and how that conveys and really understands from some of the coverage, the pre-authorizations that are just a nightmare with a lot of our payers. It's based on that diagnosis a lot of times. That's how we know for that diagnosis, this is what they're going to allow you to do. And so we want to make sure we're starting off understanding the complexities and the ins and outs, just to have that baseline for it as well.
Wonderful. Well, that is really a meaty session that you're going to be presenting, and there's a lot of content there. I'm really excited to attend this fall.
It shouldn't be too overwhelming, hopefully. So it'll be good, I think, to kind of really just give some highlights to some of the areas that people may not even think about. So
awesome. That's really exciting. I'm really excited to attend your session this fall, and I can't wait to meet you in person.
Well, thank you so much.
All right. Thanks a bunch, Teri. I hope you have a great day.
All right. You too. Thank you.
And thank you all to our viewers, and we'll see you next time.